Welcome to today's lecture on the advanced topics in medical semiotics. In this comprehensive script, we will explore various aspects of neurological examination techniques and their applications in diagnosing and monitoring different neurological disorders. From the evaluation of tremor disorders to the interpretation of neurophysiological tests, this script aims to provide you with a detailed understanding of these complex topics. So let's dive right in. Tremor disorders present a diagnostic challenge due to the overlap in clinical features among different conditions. In this topic, we will discuss a comprehensive evaluation of tremor disorders, including essential tremor, Parkinson's disease, dystonia, and cerebellar tremor. You will learn about the specific characteristics and differential diagnosis of each condition, along with the key examination techniques used to distinguish them. Neurophysiological techniques play a crucial role in the assessment and diagnosis of movement disorders such as Parkinson's disease, dystonia, and Huntington's disease. In this topic, we will delve into the various neurophysiological tests employed, including electromyography, EMG, nerve conduction studies, and evoked potentials. You will gain insights into how these tests aid in the localization and characterization of movement disorders. Neuropsychological testing is an essential tool for assessing cognitive functions, memory, attention, and executive functions. In this topic, we will delve into the intricacies of interpreting and analyzing neuropsychological test results. You will understand the underlying principles guiding the interpretation of tests such as the Mini Mental State Examination, MMSE, Ray Complex Figure Test, and Wisconsin Card Sorting Test, WCST. Advanced assessment techniques are required to evaluate speech and language disorders comprehensively. In this topic, we will explore in detail the evaluation methods for disorders such as aphasia, dysarthria, and apraxia. You will learn about specific assessment tools, such as the Boston Diagnostic Aphasia Examination, BDAE, and the Apraxia Battery for Adults, ABA, and their significance in diagnosing and managing these disorders. Accurate assessment of vestibular function is crucial in diagnosing vestibular disorders. This topic will elaborate on detailed examination methods for assessing vestibular function, including positional testing, electronystagmography, and vestibular evoked myogenic potentials. You will gain insights into the interpretation of these tests and their significance in diagnosing conditions such as benign paroxysmal positional vertigo, BPPV, and Meniere's disease. A comprehensive evaluation of visual pathways, visual acuity, visual fields, and ocular motility is essential in identifying optic nerve disorders. In this topic, we will discuss examination techniques for diagnosing conditions such as optic neuritis, strabismus, and other optic nerve disorders. You will learn about specific ophthalmologic tests, including fundoscopy, visual field testing, and the cover-uncover test. Electroencephalography, EEG, data analysis and advanced monitoring techniques play a crucial role in the diagnosis and management of epilepsy. In this topic, we will delve into in-depth EEG analysis, including the interpretation of different waveform patterns and the identification of epileptic discharges. We will also discuss advanced monitoring techniques such as ambulatory EEG, video EEG monitoring, and epilepsy surgery evaluation. Differentiating between vegetative and minimally conscious states in patients with severe brain injury is a complex task. This topic will focus on examination and assessment methods used to diagnose and differentiate these states. You will learn about specific criteria, neurological findings, and multimodal assessment tools such as the Coma Recovery Scale Revised, CRSR, and the Glasgow Coma Scale, GCS. Electromyography, EMG, is a vital tool in evaluating peripheral nerve and muscle disorders. This topic will delve into the advanced interpretation and analysis of EMG data. You will learn about the characteristic EMG findings in various neuropathies, myopathies, and motor neuron diseases and how to correlate the EMG findings with clinical presentations to guide diagnosis and management decisions. Evoked potentials, including somatosensory evoked potentials, SSEP, visual evoked potentials, VEP, and auditory brainstem response, ABR, provide valuable insights into the assessment of sensory pathways and auditory function. In this topic, we will explore the detailed understanding and interpretation of these evoked potentials. You will learn about normal and abnormal waveforms, latency measurements, and their clinical relevance. Functional magnetic resonance imaging, fMRI, positron emission tomography, PET, and single photon emission computed tomography, SPECT, are indispensable tools in modern neuroimaging. This topic will provide an in-depth understanding of these advanced neuroimaging techniques. You will gain insights into their principles, applications, and limitations, along with their role in functional brain mapping and the diagnosis of disorders such as brain tumors, stroke, and neurodegenerative diseases. The diagnosis and monitoring of multiple sclerosis require a comprehensive neurological examination. In this final topic, we will discuss detailed examination techniques specific to multiple sclerosis. You will learn about assessing cerebellar function, optic nerve involvement, and other neurological findings indicative of this autoimmune disease. Emphasis will be placed on differentiating multiple sclerosis from related conditions and monitoring disease progression. In conclusion, this video has provided a comprehensive understanding of advanced topics in medical semiotics. It explored neurological examination techniques and their applications in diagnosing and monitoring neurological disorders. Stay curious, keep learning, and excel in your medical career. Thank you for watching.